Hello, Beatrice.
Hello, Dobroslawa. So happy to be with you today.
Bonjour.
Bonjour. Bonjour à tous.
And hello, everyone. So, dear Beatrice, I would like to thank you, first of all, for having this interview with me for the Polish audience. Is it your first interview for the Polish audience? I was wondering, tell me.
I think so. I have no memory to have met before.
Okay. So we have met in Bulgaria.
Absolutely.
In the International Water Conference
yes.
in Sofia 2018. And I remember that, almost immediately we found out we have a common denominator, namely the informational medicine. I know that you have been working also with Professor Luc Montagnier.
Absolutely.
And I can also remember very good when you have invited me for this wonderful dinner with Professor Luc Montagnier, with Professor Witiello, with Dr. Skorupka. It was, for me, it was really an amazing evening. But I wanted to ask you one thing, because you are an academic doctor.
Absolutely.
You are a physician with great experience. But tell us, please, how and when this second path of information medicine has started. How was that?
It started I should say a long time ago. It was perhaps the first year of medicine, because I was taking some treatment by acupuncture. And at that time, I remember that it was the sort of medicine that I wanted to do, and much more than chemical. And so I started in my head long time ago to be attracted by the information medicine, because at that time, even I was very interested by quantum physics, and I wanted absolutely to be in contact with people making research about spatial medicine, because for me it was certain it could be the future of medicine. And when I started acupuncture and the traditional school of medicine in Shanghai, and I realized that Chinese medicine was using the first theorem of relativity of Einstein since 5,000 years, and that we have completely missed this path in Occident. And we could research in this way through Einstein quantum physics and find the possibility to find that our body is energy, is light, is vibration, as the Chinese medicine is doing since so much time. And after that, I started homeopathy. And homeopathy was a fantastic discovery for me, because it was just the application of this traditional medicine in something like matter, like, in granules, you could have information also. And that started my really amazing path to this quantum medicine, this information medicine. And I've just finished a film about a big congress organized 3 years ago. It was in Bourbon-l'Archambault with Professor Montagnier, Professor Marc-Henri, Professor Albert Claude Kemoun. And that is the name of the film is The Science of Homeopathy. And we could perfectly understand what is homeopathy, but all information medicine, through the discussion we have with a quantum physicist and Professor Montagnier, and all that applied to the biology and to the medicine. And today we have to face this reality. We are going to really a big revolution in medicine with this informational way of treating people.
Thank you. Thank you for sharing that. It's a wonderful story. And I remember when we met and you told me about your background. It's absolutely fascinating, Beatrice.
Yeah, sure.
But let me first of all, because we started already to talk, but let me first of all, before we continue, to introduce you to the Polish audience. And let me please do it in Polish.
Oh, yes.
Thank you. So, witam Państwa bardzo serdecznie jeszcze raz. Nazywam się Dobrosława Kwiatkowska. Prowadzę w Poznaniu gabinet terapii holistycznych, medycyny informacyjnej i energetycznej Healing Fields, gdzie pracuję w oparciu o z jednej strony psychosomatykę i somatopsychologię, które studiowałam, ale też o medycynę energetyczną, medycynę informacyjną. Specjalizuję się też w pracy z diagnostyczno-terapeutycznymi urządzeniami niemieckimi marki Timewaver. Natomiast do spotkań z cyklu Dobrosława Kwiatkowska Invites zapraszam naukowców, lekarzy, nauczycieli, wykładowców z całego świata, którzy w znacznej mierze z jednej strony są moimi serdecznymi przyjaciółmi, tak jak dr Milbert, ale przede wszystkim są prelegentami naszych międzynarodowych konferencji medycyny informacyjnej i energetycznej, które jako prezes i założyciel Polskiego Towarzystwa Medycyny Informacyjnej i Energetycznej, które organizuję razem z moim zespołem w Polsce. Dzisiaj mam ogromną przyjemność gościć dr BEATRICE MILBERT z Francji, która będzie również prelegentką na naszej drugiej konferencji medycyny informacyjnej i energetycznej w Poznaniu, która odbędzie się na wiosnę 2022 roku. Dr BEATRICE MILBERT jest doktorem nauk medycznych, jest lekarzem medycyny akademickiej, jest specjalistką wysokiej klasy od chorób zakaźnych, od chorób tropikalnych, ale przede wszystkim pracuje z takim podejściem bardzo oryginalnym, ponieważ jej praca jest synergią z jednej strony medycyny akademickiej, z drugiej strony synergią homeopatii, medycyny integralnej, medycyny informacyjnej. Natomiast głównym aspektem jej pracy jest leczenie boreliozy w oparciu właśnie o medycynę integralną i medycynę informacyjną. Dr Milbert jest mówcą na międzynarodowych konferencjach, gdzie najczęściej dzieli się swoim doświadczeniem, przede wszystkim jeśli właśnie chodzi o leczenie boreliozy, ale też dużo mówi o negatywnym wpływie środowiska elektromagnetycznego na człowieka. Dr BEATRICE MILBERT współpracuje z wieloma naukowcami światowego formatu, takimi jak profesor Luc Montagnier, laureat Nagrody Nobla. Jest również autorką wielu publikacji i książki pod tytułem Trésor de plantes médicinales, po polsku Bogactwo roślin leczniczych. Bien, Beatrice. We can continue. We can continue in English. I was trying to make it fast as possible, but there's so much to say about you, and I didn't want to make it short. So
thank you so much, Dobroslawa. Anyway, I'm sure it's perfect.
Thank you. So you already started to talk about information medicine, but tell us, what is the biggest treasure from your point of view of the informational and quantum medicine? What do you think?
I think certainly the most important is that it's safe. You know, when you use allopathic treatment, you have a lot of secondary effects. And when you use informational medicine, it is exactly the shape that is made for the patient, for the trouble he has, you know, and that is absolutely safe. You have no side effect. And the only thing could happen that it doesn't work. But otherwise, it's always made for the characteristic of the problem of the patient. That is, for me, the aim of integrative medicine. Integrative medicine, really the aim of a treatment is first the patient, you know, is first the patient and his safety, and it can be cured very easily and perfectly, and that for me is, I should say, a grace, you know, it's a grace to have this sort of medicine. And I'm so proud to be able to, you know, to make the promotion of this possibility. And often I'm telling me why this doesn't exist in hospital, because there's so much sufferings with this problem of, you know, most of the people who are in hospital today, it is because of a side effect of the treatment. And that for me, it's not possible. It's not anymore possible with the medicine we propose, informational medicine.
Yes, yes, definitely, definitely. It's, you know, unbelievable, because many patients of mine are asking the same question, because they can see it's working. So they are asking me why we cannot experience that in a hospital, why we cannot experience homeopathy, why we cannot experience information field medicine, radionic, frequency therapy. It's working. They can see it's working. So I think it's the way we should go. I think just to open minds of friend of us from this area of medicine, to show them, to invite them to a dialogue, I think, you know.
Yes, sure, and to experiment also.
Yes.
Because I start to understand that clearly when I was in China, and in emergency, you know, you have this possibility to have acupuncture. And it was working very well, even on stroke, you know. And so people arrived with a coma, and it was easy to put one needle and to make them awake from the coma. That is an amazing story. People just looking at you as if you were dreaming. But no, it was a reality. And that was in 87, you know, in 1987, so a long time ago also. And Chinese medicine has always been, for me, a reference for all the different type of new medicine we are looking, emerging, because such ancient medicine as is something like roots in eternity, you know, and we can go towards this medicine and to make a real choice and altogether find a new path to experiment, but open the hospital to this type of treatment is absolutely necessary. We have to be open-minded. We are in the third millennium, and we have to look at all the medicine to be able to work together. It could, for me, it's a dream, but I would like so much it could be a reality for everyone.
Yeah, I can imagine, and I love, you know, this explanation you just said, that these are the roots of eternity for you.
Yeah, absolutely.
Yeah, it's so you know, so much content is in this explanation. Yes, but because it is like that, absolutely. Dear Beatrice, you have accepted my invitation. So you will be the honored speaker in our next international second Conference of Medicine, Informational Medicine in Energy Medicine in Poland, in Poznan, spring 2022. But tell me, you are specialized in treating Lyme disease.
Absolutely.
But your approach is some kind of amazing synergy made of academic medicine, integrative or integral medicine, and information and quantum medicine. Could you please tell us something more about your approach, so our participants will get some kind of aperitivo before your lecture in our conference?
Sure. I'm treating Lyme since a long time, and I should say about 20 years. And at that time, I started with a lot of different type of medicine, because at that time I was yet doing homeopathy, acupuncture, herbal therapy. And when I belonged to the group of Professor Montagnier, we started with other people to share our treatment. And at the beginning, I was very astonished, because they were speaking about antibiotic treatment. But when I asked them how long is going to be this treatment with antibiotics, they could say that it was very long, more than sometimes 10 years. And that is because antibiotics are working on Borrelia, but Borrelia is very clever, and she's just finding a place to hide, and in kystic forms, in parasites, in biofilms, and so on. And so it was evident that it could not be like this long time. And I started to speak to them about herbal therapy. And after a while, they told me that they find out it was effective. And I was using a lot of herbal therapy against parasites, against virus, also fungus, and bacteria. And it was at that moment, I should say, my best way. But one day I have a big discussion with Professor Montagnier, and he was telling me, you know, Beatrice, I can find Borrelia with frequency of Borrelia. So I'm sure you could cure Borrelia by the frequency of Borrelia. And that is we start with this approach, you know, and it was just fantastic. So now I should say I can use all this possibility, and it's different when I use herbal therapy most of the time at the beginning, and then homeopathy, and then frequency, because the more you are going to the information medicine, the more it's strong. Wow. So you can't use it at the beginning. Otherwise, you have X syndrome, you have big reaction. So now we go slowly and gently. Normally, it could be 6 months, a little 8 months, sometimes 1 year, but we're on very big infection, you know, people who have Lyme since 30 years, then even more. And we have to go very gently and slowly, but it's working perfectly. And at the very moment you use the information medicine, even if you have kyst, even if you have biofilm, it's working, you know, it's very efficient.
Yes, I'm always quoting you, you know, while I'm talking with my patients who has Lyme disease. And I often ask them this simple question when they are coming to me, if they checked themselves before if they have parasites or not. And most of them said, nobody has told me that.
Absolutely.
Yeah, and
the key is to make the parasites out, because sometimes it's the longest treatment, and we have to come again every month on treatment for parasites. But it's working, it's evident.
Yes, yes, of course, of course. We both know it. Yeah.
Yes, absolutely.
We both know it. So thank you so much. I have a next question, because we have been talking last week on the phone about your work with Professor Luc Montagnier, and also about his research and its meaning for today's situation in the world. Let me ask you, for example, about the PCR test, but not the traditional PCR test. What I mean is this one we have been talking about, and it is the quantum PCR by Professor Montagnier. What is so special about that?
In fact, it's very interesting, because he is using exactly the same way to make the dilution of homeopathy. And so he's taking the blood of the patient and making dilution of 1 drop of blood and 10 drops of water and agitation. And at the end, he obtained the possibility to have a signal of borrelia, if borrelia is inside the blood of the patient. And that is another way. It is information PCR, it's quantum PCR if you prefer. And it's very efficient. For him, it's the best to find borrelia. So, and we find borrelia for people who have metastases before and they couldn't find it. And even for Bartonella, even for Babesia, for virus. And so it's possible to make to every germ.
Amazing, amazing. It's so fascinating you are talking about. I'm sure for the people who will be watching you, it will be also yeah, a kind of huge inspiration. But tell me one more thing, because we both have been talking also about that. We are facing a challenging period right now. And actually the humankind history is a very challenging period. Actually, I was listening today morning a lecture by one Indian philosopher, Vimala Thakar, and she actually said that we should not say we are facing a challenge. She said we should say we are meeting a challenge, because she said life is not our enemy, okay? But still, yes, it's a huge exam for us, for all our human values. And actually, it's so much up to us which values we will pick, which values we will choose, okay? Because actually, in the whole world, we have 2 groups right now. It's some kind of polarization or even duality. The one group is afraid, and for them, the fear is the most relevant factor, let's say, okay? So they are just doing and obeying the rules in the strong belief it's the only way to stay healthy. And we have second group, which has values most important like freedom, human rights, and just independent thinking. And I just asked myself the question, how we can meet, because I don't want the humankind to split. I know it's a philosophical question, but I know also your philosophical background. That's why I'm asking that. Do you have an idea what we can do just to overcome this split?
I think as a doctor, you know, it's now 35 years I'm working with patients, and most of the time I see people who have fear, and I'm full of compassion for them, because it's I can understand to have fear and to have the media who said things who are creating fear. That is also the problem. People are under the fear because every day they open the TV, they just have this sort of information.
Absolutely.
Who are just made for make them having fear. So I should say first thing is to stop looking at TV. First, because it's too generating too much anxiety.
Yes.
And people have no answer to that. You know, they just have terrible information and they don't have the answer. So at that time, fear for me is absolutely normal. And the first thing, if you want to stop fear, you have to stop the screen who is making the fear in you, and to find the possibility again to speak together, to share the information, to have other ideas of treatment. That is, you know, we know with the information medicine that we have a lot of possibility of treatment. And when you have treatment, the fear has no roots, has no support, you know. What is the problem? If you have the solution, where is the problem? There's no problem. So it is for me, it's very simple. If we have no solution, I could understand. But if we have solution, we just have to share this solution. And at that time, sharing is a complete answer. We have to be able to share the most possible with all the people. And that the reason I made the film, The Science of Homeopathy, because it's starting on homeopathy, who was completely, I should say, destroyed in France, because they give a lot of bad information. But now we have the answer, we have the solution, and we want to share it. Mm-hmm. So that is the first, I should say, step on this path. And I hope we could find a lot of time of sharing and possibility to be all together. And even with, you know, with internet, it's possible also to share. It's not exactly the way I love so much to be with people, and I would like so much to be with you, Dobroslawa, today, because, you know, it's the time we could have the Congress together, but it's like this. And anyway, we share all these possibilities.
Absolutely, absolutely. I completely agree with you. I think just being open to another human being is also so important, with respect. When we show respect, but I mean a truly, deeply respect within us for another human being, and we also show understanding, okay? We can also ask, okay, why are you afraid? Okay, what do you are frightened for? Just talk, not build how do we say it, boundaries, just build bridges, just
yes.
Look for the common denominator. When you know, when I can see, when I do this effort, just first show this respect, even though I am not agree with someone, but I just ask and I show, okay, I see what you are talking about. Let's talk. Let's just show each other respect and talk. Then possibilities occur.
Absolutely.
Yes, yes, absolutely. One and last question, dear Beatrice, because you are very engaged in making information and quantum medicine popular.
Absolutely.
I know you are involved in many projects.
Absolutely.
Also in Switzerland. Could you share something more about that? What you are now on your path, just to make our information medicine popular in the world?
Oh, thank you, Dobroslawa, for this question. I arrived in Switzerland 2 years ago, and I wanted to make a university for medical students about quantum physics applied to biology and medicine. So first I create independent research for integrative medicine, that is my foundation, IRIM. And then the next structure was this university for integrative medicine. And it started slowly and gently. And we made also a center of research on the quantum therapeutics. And we start also to have, you know, the idea to make a water academia, to make all the work of Jacques Benveniste, Professor Montagnier, Professor Jerry Pollack, to make yes, because I think we have to, I'm very proud to have been to the water conference since more than 10 years, because it started in 2004, but I really start with Professor Montagnier in 2010. And I'm very proud to all the work we have been done. And that we have to share also. And we have to give the possibility to students today to have also the possibility to choose a quantum medicine and to look for the best way to cure people. Because it's like, you know, we say we have a lot of solutions. We have homeopathy, we have herbal therapy, we have acupuncture, we have also osteopathy, we have also the different bioresonance application. And that is a fantastic possibility to make people going out of their problem of health. And that is very important to form students. Now it's for me, it's the most important, because I'm near a retreat in France and I found nobody to take my patient, to take care of my patients. And that started to be for me a real, you know, questioning why we can't find any more doctors who have this possibility to treat like me, like you, in integrative medicine. Because we have to say it, there was a real repression about the system towards the doctor who are making alternative medicine. And that is not possible, because today the alternative medicine have really, we can understand them, you can understand traditional Chinese medicine, you can understand homeopathy and even herbal osteopathy with quantum physics applied to biology and medicine. And we are now, you know, in the third millennium, and we have absolutely, we are going on the moon, we are going, you know, we have a lot of possibility with quantum medicine, with quantum physics applied with all the technology. Now we have also the possibility to use it in biology and medicine. And that is giving the informational medicine.
Of course, of course. And I wish you, you know, so much luck with that. So much luck that you meet people who will go with you on this path, who will support you on this path. You have my whole support with all my heart. And anytime you want to do anything for your project, just I'm there for you. Thank you so much.
Thank you
for this conversation, dear Beatrice.
Thank you so much.
And I'm looking so much forward to see you in Poznań in spring 2022 on our conference. I will say just few words for the Polish audience now, so they can find us and informations also about our conference. But I'm sure that now, after this lecture, this conversation, they absolutely understand why I wanted so much having you among our speakers. So thank you so much.
Thank you so much, Dobroslawa. See you soon.
See you soon. And for our Polish audience, few words. Moi drodzy, serdecznie zapraszamy z dr Beatrice Milbert na naszą drugą międzynarodową konferencję medycyny informacyjnej i energetycznej PTMIE do Poznania wiosną 2022. Zapraszamy wszystkich na facebookowy profil Polskie Towarzystwo Medycyny Informacyjnej i Energetycznej, w skrócie PTMIE, albo na naszą stronę internetową po prostu www.ptmie.pl. Na dole pod filmikiem znajdziecie Państwo wszystkie informacje. Dziękujemy bardzo. Do zobaczenia wiosną w Poznaniu. Wszystkiego dobrego.